So good morning, everyone. Nice to see you bright and early. Apologies for the slight delay for our online colleagues. So we are now ready to start. I'll start with a brief recap of the day yesterday, just 2 or 3 sentences. And during dinner, we had very good conversations. So we thought we would also include in this session a bit about HEI and what we do and how we came about and where we are. So I'll ask Bob to do that in a few minutes after I do a quick recap of day one. So yesterday we had very nice deliberations. We had about, the state of evidence on health and air pollution. We looked at several techniques of how folks in Kenya and Uganda and the region at large are both looking to monitor air pollution and its health effects. And we had, nice discussions in the group session. So for that one, I should make this announcement at this point is that we will give feedback on our group discussions in the afternoon. Then we'll have, the evidence to policy session. And then the idea in the afternoon session is also for us to collectively think through which are the main things we would want to do based on your feedback from the groups. So you have a bit more time to coalesce your ideas. If you haven't done so, I'm sure you have already. And then we'll do that first thing in the afternoon when you come back from lunch. So the slide that you see in front of you is a bit about HEI and how we are in this space and what we are doing. Is it very visible or not visible at all? So I will ask Bob to just say a few things about this before we go to our first session.
Thanks, Victor. First off, good morning. It's nice to see so many people back today. And we appreciate your time and the energy that you put into this. I have first a public service announcement. Last night at dinner, somebody left this really nice set of ear headphones on a dinner table. So if you lost it, come see me, because I have it. So one of the things I wanted to talk about today is just to introduce you a little bit to HEI and what we do and why we're here, because I think it'll help inform our discussions and our directions and where we would like to take this meeting. But just for a little bit of context, HEI is an independent research institute. We're funded equally by industry and government, the US EPA, and our primary mission is to provide studies and information on the health effects of air pollution from all sources in the environment. And we do this in order to provide data to agencies, to make regulations, and to industry to make better technologies. The motor vehicle industry to make better, cleaner vehicles, diesel vehicles and automobiles, and EPA to set regulations for ambient air quality standards and other purposes. So we really provide research that's designed to inform regulatory decisions. We have a global program that does a lot of work in low and middle income countries that is supported by foundations as well. So we're an industry government partnership with a very strong program there. And we do studies, we do reviews of the existing literature. Traffic-related air pollution and health is a major recent publication. And as I said, our goal is really to inform decisions with highly credible science. Neither industry or government has control over what we do. We do everything independently with a research committee. In our global work, our goal is to, well, first off, I should say we've worked in India and China. We work a lot in Europe. We work in southeastern Europe. And our goal is to be in places in low and middle income countries where air pollution is especially high and health impacts associated with that are also quite high. We're based in Boston, but we have this global program, which is quite exciting that foundations tend to support. The work we do in our global program is threefold. We We publish the State of Global Air, which Pallavi talked about yesterday, which looks at the health impacts of air pollution in all countries and the levels of that pollution. We also publish reports like GBD maps, which I spoke about yesterday, which are the health effects of sources, all major sources in the environment, so one can begin to look at source-specific health impacts. And periodically, we also produce existing reviews of the science and the health effects of air pollution in particular regions. And I think most of you have seen the state of global air quality in Africa, in African cities and in East Africa in particular, as resources. And the goal here is to provide knowledge on the state of the science to local investigators and to politicians and the public and the media to help understand the health impacts of air pollution in different regions. And our larger goal, of course, is to inform decisions, much like we do in other parts of the world, so that stronger regulations can be put in place to clean up the air and that the public can be made aware of these issues, and the politicians who ultimately need to support those regulations will understand the health impacts of air pollution around the world as well. We look at, and in individual countries, we look at all sources. We look at household, we look at transport, we look at motor vehicles, open burning, all the sources of air pollution that contribute, including PM and ozone and other pollutants. So that's kind of our mission here. And why we're here, and I'll talk a little bit about our capacity building or our skills transfer work as well. Why we're here is we believe strongly that partnerships, working with local scientists, local media, local regulators and politicians is important. Not us directly, but working through you and our local partners to build skills to be able to have access to information to work with your leaders so that you can make a case to them and your local NGOs about the health effects of air pollution, so that over a longer term sustainable programs can be put in place to get to cleaner air. Our goal here today is to hear from you what the local issues that you have are, so that we're in a position to use the different resources that we can bring to the table, whether it's synthesizing existing information about the health effects of air pollution in Africa. We talked about yesterday a database of 80 studies in East Africa already. That can be put into a format that's very persuasive and informative to the public and to decision makers here. We also support studies of air pollution and health. You know, we don't have endless funding, but we're in a pretty good position to raise funding so that targeted studies conducted by local investigators communicating to your own leaders directly on what you see, what you discover through your research as the local impacts of air pollution can be persuasive in moving to action, and whether that's household or open burning or the local challenges, or diesel vehicles in cities, the local challenges that you face. That was part of the exercise that we started yesterday, to have you think about what are the needs here, you know, what information is priority information to communicate to policymakers and to the public. And I think it's fair to say that part of what at least I learned in my group was that there was a whole lot of work to be done, even with the public, before one gets to policymakers, and that's fine. So we're here to learn. We're here to use this model that we have of bringing industry, government, and foundations together to support science, to independent science that's highly credible, to move decision makers and the public to support cleaner air. So that's our goal. That's why we're here for the next few days. And that's why we actually have a commitment to the region for more than a few days to work with you to begin to try to put together sustainable programs. So I don't know if that's clear. I know there were some questions about HEI and what we do, but are there any other questions out there about how we operate and what our goals are? Great. Well, we're here to learn from you, because you know about your local conditions much better than we do, and try to be supportive in any way we can. So thank you again for your coming to join us.
Thanks, Bob. So we went a bit off script there, but I guess, you know, we know more about HEI now than we knew yesterday. So I'll hand this over to George to take us through the keynote address session. Welcome, George.
Thank you, Victor, and good morning. Pale nyuma, good morning. Good. Today we have one of those very rare opportunities to hear from one of Africa's greatest minds on environmental issues. I'm not talking about anyone else except Alice Kaudia, who personally has been a mentor to me. I've worked with Alice for a long time when I was in government and also when I was also outside government. Alice served as the environmental secretary, and that is the time that we really interacted. She was the first environmental secretary in Kenya, and actually the last. After she left, the ministry has found it very difficult to replace her. And she served for 3 terms, which is usually also very rare in government. She is currently a senior Africa advisor for the Climate and Clean Air Coalition. And she has a PhD in Forestry Extension and Development from the University of Anglia in UK. I have to confess that I didn't know Alice had a PhD until 2 years ago. So I worked with her for a long time until she is really down to earth. And most of you who are in this sector and are new really consider her one of our greatest mentors. So today she'll be talking to us about the nexus between air pollution, energy, and development. And Alice, please come. Please help me welcome Alice to the podium.
I'll use this one. Okay. You hadn't put it? Okay. Okay, good morning.
Good morning.
How are you, Ni? Yeah, Victor is still trying to help me to load up my script, because they always say when you have worked for so many years, if you don't script your work, you may talk so much and talk some useful things or some most of irrelevant things. So sometimes we always try to tail ourselves. But I'm very delighted to be here. And I think it was a great opportunity that I was given to come and share with you. As has been said, I've been working in the government, and since 2018, I retired and became over-engaged in public work, actually, serving the continent of Africa in a different capacity. So, as I said, I'll try to be on my script, but I rarely use the script anyway. But I think we know why we are gathered here this week, mainly because we are all very concerned with the challenge that is presented to us regarding air pollution and energy. So, but before, just as part of this speech, I just want to tell you a small story. And the story I'll tell you will inform us when I'll come to say, moving forward, as Bob was asking, what are really our issues in this place? As a little girl, picture me as a little girl, no? Tiny, tiny kid, age 10 to 14 years. I would go to the bushes nearby in my home village in Siaya County, Western Kenya, to gather firewood. Come and light that 3-stone fire and cook. But to make the fire light, I would have to do what? Blow air into that stove. And the first white smoke that comes, it normally is like it's driving itself towards you. And I would inhale that, get choked, run out of the kitchen, then get some fresh air. Anyway, down the line, there was some development. Therefore, my mother bought the paraffin stove. I don't know whether you remember that as well. It would light blue, and later on in physics, I was told blue flame is the strongest flame. So I think that was development. But again, this one, when you have to set it off, you still have to blow, and I would blow, And then as it's going off, there is smoke, and inhale that again, run out of the kitchen, breathe some fresh air, and feel relieved. I didn't even know that that is air pollution. I didn't know it affects health. I didn't know. All I was doing what? Cooking. So that story tells you on how we are and how we have been. But as I grew up, many years down the line, I found myself working at the interface of renewable energy, mainly renewable energy. That was 1984. I was one of the first 6 managers of the Kenya Renewable Energy Development Project. Through that project, we promoted renewable energy technologies and innovations. As a young graduate, my job was to extension. You were told I went and studied extension again later, because that was my field. And we promoted solar lighting system. I remember my first office, we had the solar panel on top and a battery, the normal car battery, to store that energy so that the light was on. And then we also promoted biogas. We had kettle, and we would teach communities that, you know, when you have this dung, put it in a biodigester, and you'll get this gas, and use it for cooking and lighting. And all those were demonstrations. We promoted renewable energy crops. The focus was mainly energy and saving the household costs. And I was very surprised that this week in the East African newspaper, I still read about that access to LPG gas is out of reach for households in Uganda and Kenya. So thanks to HEI for working in Uganda and Kenya, we still have the problem many decades down the line. So over 2 decades have gone, 3 decades have gone, and I think at this point, allow me to share with you some findings of a recent assessment, which I was privileged to coordinate as the Senior Africa Advisor at the Climate and Clean Air Coalition. This was the integrated assessment on air pollution, climate change, and sustainable development in Africa. The assessment was taken as a partnership between the African Union Commission, Stockholm Environment Institute, Climate and Clean Air Coalition, and UNEP Regional Office for Africa. It was contextualized within the global arrangements of focusing on action to tame climate change. But we brought in the development aspect by saying that, what does Africa want? We have the Agenda 2063, the Africa we want. We have the NDCs. We have the Agenda 2030. So we brought in all the concerns in this and identified sectors in a participatory way which we could focus on. We focused on the transport, energy, agriculture, energy from production and consumption side, household energy use, and also the aspect on road transport, I think I've mentioned that, and waste management. I think I saw Andriana in the list. She's not here today, but she has been one of our colleagues there. What we find is that from a health point of view, overall, the assessment informs us that if we take no actions in the 5 sectors that I've mentioned, we are going to have a worse situation in time to come. It is estimated that annually we could be losing 930,000 and 1.6 million lives per year prematurely in 2030 and 2063 respectively. So in 2030, imagine if from Africa we lose 930,000 people, and by 2063, 1.6 million. Life is precious. And the other day, somebody said, you know what life is? It's A, B, C. It's the air we breathe, the blood that circulates it, okay? Yeah, it's the air, the blood, and the circulation. Now, to develop, you need healthy people. We can't be healthy without air. So the energy use, the air pollution, and our health are annexes. And we are saying, let's handle these as annexes. In this assessment, we took air pollution, climate change, and development as annexes. And the models were run to show us what happens if we have business as usual scenario, what happens if we reduce short-lived climate pollutants like black carbon, methane, hydrofluorocarbons, and nitrous oxide. What happens by 2063 if all the policies in Africa are helping us towards climate resilient and clean development? The assessment also tells us that if there's no action, then the area of indoor air pollution, household air pollution in particular, will be very bad for us. And this is where we have a lot of negative impact, health impacts on women, children, and the elderly. You know, nowadays, when we talk of the elderly, I look at myself first. Say, am I also going to suffer air pollution because of this situation? And we are saying that if we don't take action, we have another disturbing figure of 170,000 and 150,000 lives being lost every year by 2030 and 2063 respectively. Greenhouse gas emissions are also likely to triple, and therefore the climate situation will also worsen. And I think when we look at the global scenario, the floods, sometimes nowadays in YouTube you are saying if this was not captured, you would not believe it happened. And it gets very scary, you know? So we really need to manage this. And in particular for Africa, let me mention, because it was said, what is really our problem? I think in Africa, let us have a very, very clear program to reduce emissions of black carbon, PM 2.5. Because people are not aware that these tiny particulate matters, when we inhale them, our health is affected, okay? So black carbon, methane, PM 2.5s, and other pollutants should really be a priority in our region. So we need to continue studies, see what to do, and in particular inform government policy on action that should be taken. There are a number of conclusions that were drawn from this assessment. Number one is that urgent action is needed to transition to renewable energy, phase out hydrofluorocarbons, improve energy efficiency, and drastically reduce emission of methane. That was the first cluster of conclusion that came. And this is very relevant to our region in East Africa. Now, some of the findings, most of the findings we had, the total was 37 measures across the 5 areas. But we found that many African countries are already taking action to reduce air pollution by adopting low-emission climate-resilient development. The only worry I have as a practitioner who has been in the government for a long, long time, and who is also now practicing out of government, is our policies are not stable. By stable policies, I mean, if we say that we will have a system whereby we transition to clean cooking solutions. For example, now we have induction cookers. What do we need for this technology to be adopted by the most poor person? It is the cost. Is it affordable? Is it affordable? We have had situations where government have got very good policies to promote LPG gas uptake or electricity uptake. But how will you cook when there's outage for 2 days and the electricity is there? So we need affordable, reliable supplies of clean energy to help us to develop, to help households to function properly. We also found that a continental country-led clean air program steered by the African Union Commission is needed, and the AU has actually committed to that. So the way we are structured in Africa, we have the regional economic blocks. So in our case, and for the purpose of this meeting, the East Africa community is the economic block we belong to. And therefore, it would be important that we work towards continuously messaging these issues in the meetings to say we need a continental clean air program. We realized that when we started working, actually, it's the African Union Commission that came and requested the CCSC to say, can we help in developing an Africa clean air program? Even as we do so, we will remember that in 2008-2009 period, those of you who have been in this field, we had the regional air quality agreements. And these regional air quality agreements are there, but are we implementing them? Are we pushing them forward? So we say, for these 37 measures, these regional air quality agreements, because they were already accepted by the regional blocks, the EAC, the SADC, the ECOWAS, the Maghreb, and so on, we should anchor the process of implementation in them and see how we can move forward. Most important, then the fourth one is access to data. I think we were told the Health Effect Initiative does independent research to generate data. We do hope the data is then open access data. It's accessible, it can be used, because as we did our modeling on this assessment, it was so difficult to get data on Africa. Although we did inventories for all the countries, but it was very, very difficult. We were structured to have focal points who were able to work with ministries and mine and get us the information, but open access data which can help research is an area where we really need to intensify action. And the data structure should be such that it is simple and easy to access, even by the early career researchers, so that we don't say it is Professor so-and-so who can get this for us. Most importantly is that we need a very structured public education and awareness about air pollution. I was imagining, supposing we have a wearable gadget, like a watch, okay, which I see my little toddler grandchildren wearing, and it has got a dial, red, amber, green. Because they are very familiar with traffic lights, it can tell them this is the status of air quality. When you go to this and they say, oh, it's red, I should not be here because the air here is very polluted. Public education and awareness is very, very important because it brings us down to the area of changing attitude and behavior. I can assure you, many of us in Kenya now, and my colleagues here, you will attest to that. We have gas in our households, we have electricity in our households, but you'll find that for certain African dishes, we'll say if it is cooked over the fire and charcoal, it tastes better. Isn't it? It tastes better. I can't cook this kind of food on gas, I can't cook it on electricity. So even if we have the technology of induction cookers that are very efficient, clean, even if the government had a policy to make them affordable, okay, until the attitude and behavior of the consumer is changed to appreciate that if I use this gadget, I will be contributing to ensuring that we have clean air for all, we may not move very, very far. We can have sound scientific data. We can have good evidence. We can convince the ministers, okay? But you see, the minister is not at my household level. Then we also need to map who are our critical, would I call them primary customers, okay? For the different energy sectors, so that we have a targeted communication to them, so that we can change their attitude and behavior towards the, in energy production and consumption, and in particular towards actions that contribute to pollution. You know, open burning of waste, open burning of agricultural residues. We take it as a practice to manage the environment, but we don't link that to the pollution that arises out of that. We found that substantial health benefits, for example, preventing 200,000 premature deaths from indoor and outdoor pollution by 2030, 830,000 deaths per year by 2063 is going to be possible. Cutting carbon dioxide emissions by 55%, methane by 74%, and nitrous oxide by 40% by 2063, and significantly contributing to the global efforts of keeping our warming to below 1.5 degrees so that we limit the negative effects of climate change and support development. The other thing is, as people, when you came here, what did you do first? You went for coffee. Food security. Food security, yes. If we don't manage our energy systems well and we continue polluting from that sector, will affect our climate system that will contribute to desertification, reducing crop yields. We looked at rice, maize, soy, and wheat. These are common staple foods globally. Those from this part of the world know that when you don't get the maize meal, then you have not had food. You know, you can have your nice sandwiches with hamburgers in between, nicely decorated on the table, but someone will still say there is no food, yeah, because the maize meal is not there. So we have a real opportunity in Africa to move more quickly compared to other parts of the world with less pollution from the energy sector to achieve the African we want, and I think together we can. So as I conclude, let me just say again, thank you very much to the organizers of the workshop and for creating this space for me to share with you my experience on the energy, air pollution, and development nexus. It is a slow process, but technology and innovation is enabling us to move faster. When I compare the batteries where we stored energy in 1984 and the small Panasonic batteries of livable homes of today, it's very great. The key thing is let us use scientific data to inform policy, have sustainable policies that can make the energy efficient and less polluting technologies and innovations affordable to as a large segment of our population as possible. I thank you. If you have any questions, I'll still hang around because I am in that age where nobody gives me scholarships. So when I find an opportunity to learn like now, I'll be around to learn.
Yeah, we invite questions, but because I have the mic, I'll come to you. I'll ask the first question. Because you operated in the government for such a long time and you are at the top of the policy making, what is the advice you can give this group for people who are really doing a lot of work on air pollution and they're kind of getting a little bit frustrated with the pace of policy side movement? How can we fast track the policy development and also implementation?
Thank you very much. I was once told to give an interview to some organization on how can you influence your boss to take a decision in the public sector. What I find is that when you start these processes, have an engagement strategy. An engagement strategy that brings on board the government players, whom you should have mapped very critically to know the scientists, the politicians, the members of parliament, the Senate, and what are they talking about as the issues that their constituents are concerned about, because they want those votes next time. So make it relevant to the government. For example, now if you are working in the East Africa Community region, we really need to know what is the concerns of governments within the EAC, you know, but start it at the country level, because the regional process is informed by country level processes. So look at the development priorities. I always tell scientists, please, when you are designing a research activity, don't sit at the table and study the journals and the publications in that line alone. Because that alone will not give you the end product that will be able to influence policy. So read the science journals, yes, to get the scientific gist of the issue. Then read the policy documents. What are the regional development plans? What is the EAC treaty saying about this? What is the Environment Council of the EAC talking about? That the EAC have a regional climate change strategy. Yes, they do, I know. What does it say about air pollution? If it doesn't say anything about air pollution, can you find that to be an agenda in the next ministerial council so that it is discussed and accepted? Let me give you the example of the assessment we did. We got a mandate from the African Ministerial Conference on Environment. So there is a ministerial decision for the whole of Africa saying that, yes, we want countries who are members of this council, ministerial environment, to undertake to prevent or manage air pollution as nationally appropriate. You know, we normally look inwards. So then from there, the assessment is taken. Then we went back for another mandate. So then the AMSEN again said, we urge member states to implement the 37 measures across the 5 areas. Action areas, okay? So always position your research with national, regional development priorities. So you don't take it as air quality alone. Neither do you go as climate change alone. Neither do you go as energy alone. It is in the context of development aspirations of that region, you know? What is Kenya's Vision 2030 saying? What is Rwanda's Vision 2050 saying? What is Uganda's, I think they are also in the 2030. So you look at all those policy documents to say, yes, if we get results that inform the policymakers this way, they are likely to support the implementation, because at the end of it, your research has only value if it is implemented and it transforms the lives of people and the environment positively. Thank you.
That was a great leakage for those of us in the sector. I'll give Professor one more question and then we can end.
Yeah, thank you, Hani. Alice. Huh? Not quite, Alice. Okay, thank you. Now, just a couple of things. You talked about regional air quality agreements, and I was just wondering if these agreements are different for the different regions of Africa, and if so, what are the differences, and how can they be put together so that they can inform the continental, strategy? And then you also talked about, or when you're talking about policies, you mentioned 2 things. One, the issue of unstable policies, and then you also mentioned sustainable policies. So I just wanted to understand why you think that some of these policies are unstable in countries, and how we can make them sustainable. And lastly is the fact that most governments tend to work in a very siloed way. The ministry responsible for environment will be thinking about just certain issues, the ones responsible for energy, transport, and so on. So how can we, encourage multi-sectoral approaches, in addressing some of these issues? Thank you.
Thank you very much.
There is an additional question from Jessica from Ghana, who is participating online. And she is asking, is there responsibility and accountability for high-income countries on their contribution of air pollution in low and middle-income countries? So I'd request you to tackle those 3 questions, and then we end it there. But Alice will be around. Please make sure you meet her for tea. And also one thing I wanted to request, Alice, is on your badge, there is a section that asks, ask me about, and please fill that so that we can follow you over tea and ask you about that particular thing. And if it's not on air pollution, even better. Maybe Western Kenya food, something like that.
Okay, thank you very much, Professor Guge. I think the question on the regional air quality agreements, yes, these regional air quality agreements were specific to regions. I mean, the way we are structured in Africa alongside regional economic communities. Sometimes we call them blocks. So we have the SADC, the EAC, ECAS, Maghreb, ECOWAS in the West, and so on. And I think this arrangement was necessitated by the differences in our socioeconomic capabilities, which are rather regionally, and also socio-cultural similarities. And therefore, they are very, very specific to those regions. But there's something beautiful about air. It doesn't have a culture. It doesn't have a geographical boundary. It doesn't have administrative boundaries. So you find that whereas we are structured that way for purposes of effectiveness of common interest groups, so to say, they're very different in a way, depending on the socioeconomic circumstances of a region and the socio-political engagement systems. On whether they can be brought together, yes, that's what we are trying to do by saying that because all these regional economic communities answer to the African Union Commission, when we create the Africa Clean Air Program, which is now being structured within the AUC 2023 to 2033 decade strategy, the second segment of Agenda 2063, then of course all these regional air quality agreements will inform the content of that program. And I think they're being consulted actually. It's a consultative process which is going on. Your second question was on unstable policies and unsustainable policies. Now, the policies become unstable when they are politically pushed. And therefore, the next government switches, oftentimes switching us backwards instead of taking us forward. Because there's this underlying assumption, a new broom sweeps better, which is not the case. And therefore, that has been a very strong undoing in Africa. But sustainable policies will be those which are based on the real needs of the people and this deep analysis of ability of the consumers to take up that technology. And that ability comes with simple thing called the price. Is it affordable? You see? We have seen that with the mobile phones. Even if I am in the village and I don't have a 5G, I will still have that non-smartphone. We call it, let me not, no, we don't want to call it that way. Kabambe. Yeah, it's very tiny. But the person will still communicate. Then look at the unit of consumption cost. Prof, I know you can load your phone with 2,000, okay, per day. But as a villager, I can also load it with 10 shillings or 20 shillings airtime, right? I will still talk and communicate. So that affordability and having, oh, you have a kabambe. Yeah, yes, one of us has a kabambe. Kabambe is this one. That's a kabambe. Yeah, so afford, I always say, when I look at the way we have moved with technology in promoting, for example, household biogas digester, why is it not taking off? Since 1984, now we're in 2023. You still find that you are told, oh, there is a project promoting biogas in counties, and every county has been given 2 units. What's 2 units? You see? So also the scale of application should be weighted in the whole policy formulation. So the sustainable policy will be that will live beyond different government systems and serve the people that need to be served by that policy. Then you have talked about silos in governments. It's not just in governments, even in companies. Companies are very selfish because they say that's a company secret. Even in NGOs, NGOs are very selfish. They'll say this is our sphere. So we are all human beings. We are selfish. But you will not be selfish about poor air quality. If it is here, we are all breathing it. It will not matter whether you're from environment, mining, whatever. So that's the beautiful thing about air pollution and climate change. It is the same ship. We sink together, or we float together, or we rise together, you see? So I think the silos, I will give an example of how I did it when I was the Environment Secretary. The key thing was to set up an interagency consultative forum, which met quarterly. Even with the private sector, we had the private sector forum, and the private sector could bring hard questions to the ministry and say, look, your regulatory agency, NEMA, is not functioning. They have stopped us from doing this and that, you see? So those hard questions could be brought to the table through that interagency process, but it had a political support because those reports went to the presidency. And then the presidency gave instructions and directives. You see? That's different. When you're instructed and directed, you take the action as prescribed, okay? Infusing your technical know-how to make things work. So I think the silos can easily be broken in this aspect of us working towards preventing, managing air pollution, because it is a transdisciplinary, multidisciplinary, multi-stakeholder challenge. It doesn't resident in one ministry, even if one ministry is given that responsibility. I see, for example, in Kenya here, the Ministry of Environment working very closely with the industry and very closely with the energy and very closely with health, because all these are interconnected. Yeah. Then we had our sister from Ghana saying that what can we do to assign responsibility to developed countries for sins committed on the environment and protect the low-income countries. I think that was her question. I've paraphrased it, but I hope I have done it well. I think when it comes to issues of air quality and climate change, we all have a responsibility. And whereas it is appreciated that industrialization and the use of certain types of energy could have contributed immensely and continues to contribute to air pollution and climate change, I think there is a framework within the UNFCCC system, within the Paris Agreement, and within the NDC commitment systems that is enabling the developed countries to work with the developing countries to address this issue of air pollution and development. And I think for Africa, most of our countries have committed to low emission, climate resilient development, a very overarching policy statement that then allows countries and regions to unpack that depending on their national and regional economic circumstances. But I do want to agree with your thinking, Jessica, that we need to negotiate with the developed countries to continue supporting developing countries, because again, if we don't have the financial, technological, and knowledge capacity to address these issues, simple instrumentation of having low-cost sensors everywhere for us to know the quality of our air, then we will not be able to move. And I think there is injustice in that kind of system. And following on the aspirations for us to be one humanity, one planet, since we are sharing the planet, we all need to work together. And those who are not capable, we uplift them. And therefore, I would want to agree with Jessica that yes, those of us from developed countries, let us work together with those in the low-income countries to also ensure that we have clean air for all. Thank you.
Thank you so much, Alice. You can take a seat now. And we really appreciate the knowledge shared. And we were really excited. I got a couple of very nice notes. If you want to really get those notes, I can share later on. So with the permission of the committee, I want to give it now to the next chair for the next session, Jerry Opondo.